Hello, hi, how are you today? This is Sherry, the Preventionist Show. You are so welcome, and I tell you today, you are in for a treat because we are talking about occupational health and safety. When you talk about occupational health and safety, these are things, these are practices, programs, policies that organizations do to ensure that their workers do not get diseases or injuries because of the work that they do. So today we are so privileged. We are one of the professionals or one of the occupations is represented, and in a while I'll be bringing my guest to tell us more of what he does and about his work. But I want to tell you that Sherry the Preventionist Show, we encourage people to stay ahead of the disease, to stay ahead of injuries, because prevention is better and cheaper than cure. And with that, I am so much going ahead of myself. I want to welcome my guest who is going to introduce himself and tell us what he does. Fred.
Yeah.
Sasa,
Mzuri sana.
uko aje?
Uko poa?
Karibu sana.
Asante sana.
This is Sherry Preventionist Show.
Good to be here.
Here we talk about disease prevention,
Yeah.
because diseases can be prevented. In fact, wasomi wanasema 80% of diseases can be prevented, and there are some diseases that can occur or conditions can occur because of the work that we do. So today you will be talking to us on what you do, and maybe we will carry on from there. You can introduce yourself.
My name is Freddy.
Yeah.
Mwaniki, or Freddy the makeup artist. For me, I normally use the bike to do my daily work, which is makeup, especially when I'm doing the house call, when I'm attending to my client on site or where they are on their location. So I normally use my bike to commute. So riding a bike is a daily thing for me.
Asante.
Yeah.
So karibu sana Freddy, and congratulations, you do a good job with the makeup.
Thank you.
Yeah, so for how long have you been a rider?
I'd say more than 8 years.
More than 8 years.
Yeah.
So as you heard me while I was introducing, today we'll be talking about things to do with occupations. So on a later date, if it's okay with you, we can do something to do with makeup, but today I want us to focus on the bike.
Okay.
So you've been a rider for a whole 8 years.
Yeah.
Are there maybe some of health effects that have arisen, or you can be able to associate with your passion to ride, and even just as a professional rider?
Yeah. I would say the more common one, which is pneumonia.
Yeah.
Then the second one is the maybe say an eye infection,
Yes.
which was caused by an insect that got into my eye by accident.
Okay.
Yeah.
Okay. So pneumonia is the commonest,
Yes.
and then the eye, you got an injury of the eye.
Yeah.
Yeah.
An insect happened to pop in my eye.
Okay.
Yeah.
So in your work, is there a time that maybe there is an organization or there are people who enlighten you how you can be able to prevent yourself against that kind of a disease and injuries?
Okay. I belong to a group called Nyumba Kumi, Thika Road Nyumba Kumi.
Oh, Thika Road, Nyumba Kumi. Yes.
Yeah. Once in a while, we tend to have trainings. Training on how to ride the bike professionally,
Okay.
safety matters. They
Yeah.
also at times they organize for first aid trainings
Yeah.
to help the riders in
Wow.
averting some of the
Wow.
accidents or injuries that can be prevented.
Okay. So
Yeah.
this Thika Road Nyumba Kumi comprises of only bikes. You know, when you talk of Nyumba Kumi, it's like we are hearing the security. You know, the way the Ministry of Interior, they organize people into Nyumba Kumi. Is that what you're talking about, or this is just for riders?
This for riders.
Okay.
Yeah.
Okay.
Whereby we meet once a month.
Oh.
Yeah.
Okay.
For various activities, which of some of them involve about safety. Safety riding, that is.
Okay.
Yeah.
Okay. So in this group, the organized group, it's a registered group.
Yeah.
You get somebody, you're empowered on safety, on how to protect yourself. Okay. Maybe you can share with us some of the protective measures and safety measures that you practice as a rider, or maybe you have been taught within the group?
Okay. Mostly we are encouraged to put on the full gear,
Yeah.
which involve the riding boots.
Oh, okay.
Then you have the knee guards.
Yeah.
You have the jackets.
Mm-hmm.
For this, not just an ordinary jacket.
Yeah.
It has the elbow pads.
Mm.
Have the elbow pads.
Mm.
Have the spine pad.
Oh, spine pads.
Yeah.
Okay.
Then you have something to cover your face, like the balaclava, which
Oh,
the
maybe
balaclava.
you can show us the
The
balaclava.
balaclava. For this one, most you tend to put it this way.
Mm.
Yeah.
Uh-huh.
This work as to prevent your helmet from getting your sweat direct, and as well it prevents you from breathing the air directly.
Okay.
Yeah.
Maybe you can repeat again what you said about the balaclava, because I think maybe it was not clear
Okay.
when you hid your mouth. You can maybe tell us again.
You can see.
Yeah, we can see it.
Okay.
We can
The
see it.
balaclava. So for the balaclava, you
Mm.
normally use it to prevent, just in case you happen to sweat, you prevent it from notifying your helmet,
Yeah.
and again it acts as a barrier for you breathing direct to the air when you are riding, especially
Yes.
when you happen to open the visor.
Okay.
Yeah.
Okay.
Then we have the helmet,
Mm-hmm.
which
Mm-hmm.
which
The
comes
helmet.
for the helmet.
Yeah.
For the helmet, you have a
Mm-hmm.
certified helmet.
Okay.
Not in just any other helmet.
Mm.
We recommend a DOT
Mm.
helmet certified.
Mm. Mm.
The other organizations that have certified helmets,
Mm-hmm.
but DOT is the more common one.
Yes.
For the helmet, we have the visor, which we recommend should have two lenses, whereby you're not affected to see when it's raining.
Okay.
Yeah,
Uh-huh.
and they tend to form a film
Yes.
when it is raining.
Mm-hmm.
And most are tend to form, but
Moisture.
in this case, this one can't form.
Yeah.
Again,
That is why it is important to have a certified one,
exactly.
because if it is not certified, the
Mm,
quality is low.
exactly.
So during rainy
Mm.
seasons, your vision is
Very
blurred.
poor.
It's
Exactly.
poor.
Yeah.
Yeah.
We also recommend if you can have a two-in-one. As
Yeah.
you can see, this one has a
Maybe you can show the 2-in-1.
okay. The two-in-one helmet. But we also have the sunglasses.
Oh, okay.
The yeah.
Okay, you can show the
A
graphic.
bit, you can see the inbuilt sunglasses.
Yeah.
So you can put when the sun is too hot,
Okay.
to prevent you from the UV.
Yes.
So, when too sunny, you can put them on.
Yes.
Yeah, then you can retrieve
Wow.
back.
Wow.
Yeah.
Why? I didn't know
Mm.
that there is the visor part,
Yeah,
and also there is the sunglasses part
but
to
exactly.
protect the eye.
Yes.
But you see, Freddie, you see most of the riders, like the boda riders, you see the visor is there, but they put it up.
Mm.
So it is very important for people to know that this is not just for decoration.
Exactly.
It is a protection
Yeah.
for the eye.
Yes.
And especially because somebody is facing very strong wind,
Winds.
and there's a possibility that wind
Exactly.
dries
The eyes.
the eyes,
Mm.
which predisposes the eye to the infection.
Mm.
So guys, the element is very important. Apart from protecting your skull, it is also protecting your eyes, and it is also increasing visibility to reduce accidents.
Mm.
Thank you.
Yes. Then we have the gloves. The gloves. The purpose of gloves. The gloves. Good quality gloves should be cushion.
Very
Again, apart
important.
from preventing you from falling off and getting injured the fingers, the gloves should have good padding.
Yes.
The good padding tend to prevent vibration.
Yes.
Yeah, you reduce the vibration. I'm
Sure.
sure you talk about the effect of vibration on the hand.
Yeah.
Yeah.
In fact, you're saying something very important, Fred, that the glove should be cushioned, because we are protecting the hand also. Because the hand also, especially a nerve called the median nerves that run from the forearm to the palm. When that nerve is affected, it can cause a condition known as a carpal tunnel syndrome. So it can cause carpal tunnel syndrome because of that frequent vibration. So if the glove is cautioned, it acts as a preventive measure. We call them personal protective equipment. So guys, if you are a rider, you need to invest on a glove that is cushioned, because it is going to prevent your nerves from being affected by the vibration.
Exactly.
Yeah, thank you.
Then you have the pants. These are waterproof. Both the pants and the jacket are also waterproof, but mostly they are recommended during rainy seasons. Yeah. For
Okay.
any other normal day, you can just use your pants.
Yeah.
Yeah, but on a rainy season, we recommend this because they are waterproof.
Okay.
Yeah.
Let me ask Fred. You've said it is waterproof. Is there any other special quality about the pants again? Because there's this tendency by the riders, you find them having on like 3 trousers, 4 trousers on, you know. Is there anything else special about this trouser?
Not, I would say there's some which come padded. You don't have to put on the knee pads.
Okay.
There are those that come with the knee pads, with knee pads, but you can remove when you are washing.
Yes.
Yeah. But for a very hot season, we normally recommend you just using just the normal, especially for men.
Okay.
Yeah.
Okay.
No.
Okay. So I think it's also a good practice, because in this show we talk about small doable actions making a big difference in health. So you are saying there are specific designed trousers or pants for riders, because you know, when you overdress, of course there is a lot of sweating, there is a lot of heat, and anywhere there is wetness and the body heat, there is tendency of microbial growth. So bacteria thrive there and can predispose somebody into getting infection around their genitals. So it is very important also to invest in the right pants.
Exactly.
Thank you. You can go ahead. Is there something else that you've not talked about?
We also have what you call neck protector.
Yeah.
But for the neck protector, it's more common with the racers, the bikers who do the racing.
Yes, the racing.
It's more of a kind of a gadget where we put it around your neck to prevent, just in case you happen to fall off the bike, your neck won't snap off.
Okay.
Yeah.
Okay. I really like the things that you are describing, Fred. Especially, I've loved the part of the jacket, because people, you know, think this is just a usual jacket, but you've explained to that this jacket, it has the elbow pads, it has also something to protect the spine, which is very important. And I don't know if, Fred, you've ever visited the spinal injury hospital.
As a volunteer, yes.
What was your experience?
I would say it was with sympathize with the patients.
Yeah. And most of them actually, the accidents were either caused by riders, you know, or associated with riders. So it is very important to invest on all the things that you asked. But just to ask, how much all this would cost?
Okay.
Roughly.
The cost will depend with the brand of the clothing you intend to use, the branding of the helmets. It depends. But say could to range between 50,000 even to 150,000. Those helmets will cost 40,000. Their knee guard will cost 10,000. Their boots that will cost 25,000.
Yeah.
Especially the ones who ride the off-road bike.
Yeah.
Their equipment or their gear tend to be more expensive.
Yes.
Yeah, so it depends with the kind of bike you are riding.
Yes.
Exactly.
So it is quite an investment, but it is also a very big protection, because I'm imagining, you know, this is body. You know, when somebody is riding a bike, this is not wood, it's body. There is no other protection.
Exactly.
So it is very important, if you are a rider, to love yourself, because maybe a bike could be costing how much, the cheapest bike?
200.
200. If maybe you can afford a bike of 200,000, it is also important to love yourself and invest and have a protection of your own. Prevention is better and cheaper than cure. So today I am joined by Fred here, who is a makeup artist and also a rider. And we've been reminding you if you are a rider, a boda rider, or just a professional or you love riding, kindly invest into all the protective gears that Fred has shown us, because there are many other conditions that you can be predisposed to because of what you do as a rider. He's talked about respiratory conditions like pneumonia, like cold, because there are risk factors like the wind, the strong wind, like the sun. So you need to protect yourself. He's also talked about vibration, and for long term, with long-term usage of being a rider, you can also be predisposed to a condition known as carpal tunnel syndrome, a syndrome or a condition that affects the nerve because of that firm grip of the handlebars and the vibration. You need to have those gloves. Also, it is also important to remind yourself as a biker, the reproductive organs also can be at risk. Why? Because most of the times, especially the border riders, they sit on the bike for a very long time, and this part of the body that is the pressure is exerted on is a part we call the perineal. Perineal is the part that is in between the anus and the genitals. So there is a possibility that when you exert a lot of pressure on that part of the body for long, you can end up having erectile dysfunctions, poor sperm quality, and also prostate conditions, because there is poor supply of blood and also injuring of blood vessels and the nerves. It is all upon yourself, because prevention is personal. My health is my responsibility. Your health is your responsibility, and our health is
Our
our
responsibility.
responsibility. Your final thoughts are, Freddy?
I'd say let's take care of our bodies because that's what matters. Yeah,
Yes.
that's what keeps us moving every day.
We don't have spare parts.
Mm.
That is what he is saying.
Exactly.
No spare bodies. Take care of your body. Don't look at the investment. Think about your life. You know, we want to remain with that money. That money that you're making on daily basis, on monthly basis. Please let that money be for investment and for development, because injuries and diseases can be prevented. Stay safe. Prevention is better and cheaper than cure all the time. We can go together, Freddy. Prevention
Prevention
is
is better,
better and cheaper
cheaper
than
than
cure
cure all
all
the
the
time.
time. Small doable actions making a big difference in health. Stay safe.